So I'm going to begin today's assessment by focusing on the spine. If you have any questions, feel free to ask as I go along. I want to make sure that I am as accurate as possible. Okay. So just initially inspecting the cervical spine. The cervical spine starts right at the back here, goes all the way down to about here. And then we enter in the thoracic spine. This is the area that hunching can be worse. It's where the shoulder blades sit. Then we have the lumbar region here, and this can be an area of pain for some, as it's where the back arches. And then we have the sacral area of the spine just below here. So I'm starting at the cervical spine and just analysing. Anything that stands out. You have a slight raised area here, which may be due to posture. It's not as pronounced as some people. It's very minimal. So about here we have the pia mater. The subarachnoid space feels okay. The pia terminal spinal dura mater. The cervical spine has a great area of grey matter which sits within the spine. As we move down into the thoracic region, there is less grey matter. There is some ever so slight curvature of the spine in this region here. Okay, it sits within the normal region. We move into the lumbar area. This is where the spine curves inwards. You usually see the muscles at this point and down into the sacrum. And this is the epidural center, which you'll be familiar with, as it's where many women have pain relief during birth. It provides greatest access into the nervous system. So I'm just looking at the muscles that sit either side of the spine. Doesn't seem to be any inflammation around the spine region. for any raised temperature along the spine. And that all looks really normal. Now, just staying with the spine, I'm going to feel for any movement. So just some taps along the spine. So the grey matter that sits within the spinal cord is mainly made up of cells. And there's a greater number in the cervical spine due to its placement near the brain. Greater number of nerve endings, and this area is a lot more susceptible to damage and severe damage to the nervous system. Okay. The spine is very normal, no concerns. So while we're looking at the cervical spine, I'm going to investigate the brain stem which sits here. It's where the nervous system connects to the brain. Any pain here? Yeah. Okay. And the brain stem is where all of the cranial nerves in the body join and connect to the brain. So the nervous system runs like this. And almost mirror image. Like this, away from the spine. In fact, the spinal cord almost acts as a transport device for signals from the rest of the body. We have these nerves that run down like so, underneath the shoulder blades on either side. Down the arms, and down the spine. So we can sometimes find when we have an injury to our spine, our spinal cord, it can affect movement in the rest of the body. So just testing some of the nerves now. Can you let me know if you feel any numbness or tingling as I go along? How's your temperature?
Yeah, fine, thank you.
I'm just going to ever so slightly pinch a couple of areas just to test the nerve endings.
Okay.
So please let me know if it triggers any pain running down to the sides or back up into the brain. Anything at all? No? Okay, that's good. So now I'm going to look at your muscles. So we have muscles that run from the top of the neck here all the way down to there, and the muscle fibers run horizontally away from the spine on either side. So when you're having a massage, it's important that the masseuse pulls this way and not always directly on top of the muscles. We also have muscles that run alongside here. Very large muscle group here. And then we have some very deep muscles that sit underneath the shoulder blades. Starting at the top, we have the scapular muscles. These run either side here. And yours are nice and strong. Some slight raising on the right anterior scapulae, but I don't think it's considerable enough for it to cause any problems. Next we have on the right and left sides of the neck the rotator muscle. So they here and here. You mentioned some neck and shoulder pain.
Yeah.
Is that along here?
A little bit, yeah.
So that would be your rotator muscle. And that leads on to the clavicle and the deltoid muscles in the shoulder. Do you do a lot of movement with your arms and neck? So it could be that you have over-exercised deltoid muscles, which all these muscle regions here are connected. So I'll just feel the muscles. Yeah. They do feel tight, a little bit tense. And I'll apply some acupressure at the end just to help with the pain release of some of those muscles there. So these scapulae start here and are up in that direction. Directly under these scapulae muscles we have the extensor. And these again come out horizontally like so. And then they go underneath the shoulder muscle here. Okay. And then lower down on the left and the right hand side we have the flexor muscles. Any pain there?
No.
There?
Mm.
In here?
No.
This is where we have the scapulae stabilizer. It's a very deep muscle. I'm just going to press a few areas. Just let me know if you've got pain anywhere, okay? here.
And there, yeah.
Okay. So this is all around the front muscles here. Okay. So, areas of interest and further investigation. Your clavicle, the rotator muscles, and the deltoid. The nervous system is probably slightly more inflamed around this region. Okay. Let me just take an overall look now. So overall, I am only concerned about the areas that we discussed, and you present a very normal spine and muscle group. Recommendations: massage, ensuring you go to a qualified professional that is going to take into consideration the muscle areas and placements. And I would also recommend that you have some deep tissue massage along with rest in the regions here. Okay. Alright, so I'm going to just apply some acupressure on some areas that I know are very beneficial for pain relief, and hopefully it should provide you with some relief there. Okay. hopefully that may have provided a little bit of relief there. And I'll type up everything, send you some information on some of the muscle groups and the spinal cord as I've discussed, and hopefully this might help you with some of the pain you've been receiving. Okay.